Really appreciate you joining us. So a lot of people, when we put on this free webinar, and if I was you, I'd be asking this question like, why is this guy doing this? What's in it for him? Why should I join this? What's his angle? And to be honest with you, we are paid. Ultimately, you are going to have to choose an insurance carrier to administer a portion of your Medicare, whether it's a Medicare Advantage plan, a Medicare supplement, a prescription drug plan. And we're a brokerage, so we can help shop all of those different options for you. Your price doesn't go up because you go through us. There's no fee. We don't charge you a fee. So it really is a win-win. I put at the bottom, we're paid, but not by you. Selfishly, we want you on the best plan because honestly, if we put you on the second best option, you're going to leave us. So it's a cool relationship where we definitely have your best interest at heart, want to keep you for a long time and keep you happy. So we can get paid because we have bills too. But we've been doing this since about 2009. So I've been in business for around 15 years. We have local offices. I know you guys are being bombarded by your mailboxes filled up with all kind of spam and correspondence. You don't know what to believe. There's food cards and all these things. We have real people in our offices that you can meet with in person if you want, or you can do it over the phone, but we're not in cubicles with little headsets on over in California or Alaska or wherever these call centers are. For the purposes of this webinar, for the most part, we should have Savannah, Georgia, Hilton Head, South Carolina, Augusta, Georgia, and Greenville, South Carolina, for the most part. But we do have other locations across the Southeast, mainly. We do have one in Oshkosh, Wisconsin, oddly enough. So if you got anybody up there ice fishing in Wisconsin right now, let them know we're here for you. We've got an awesome team. We really want to help you, and I hope that we kind of convey that through this webinar. I already mentioned there's no fee for our service, so can't beat that. Let us do the hard work for you. I just mentioned our team. We have such a great group of people, and again, I'm grateful and proud of our team. So I think you'll find out very quickly that they want to help you. And you're not doing this alone. I know this is stressful and you're like, "Oh my gosh, all these letters, what am I going to do?" Honestly, you could get off of this webinar right now, schedule an appointment, and they would go through everything one-on-one with you. But hope you stick around and maybe it'll help put you at ease a little bit just hearing the information come across. Hopefully I can break it down a little simpler than what you're expecting. So what are we covering today? All the premiums, deductibles, co-insurance, all the things. Everyone wants to avoid the penalties, right? This is scary. You're like, oh gosh, am I going to get penalized? We'll teach you how to avoid the penalties. Should you even transition to Medicare? Some people can stay on their employer coverage, but we want to avoid those penalties. It depends. Is that employer coverage creditable? So we'll answer that question or try to the best we can during this webinar. Can you keep your employer coverage? And when and how should you apply for Medicare? There are different ways that you can do it. There are a lot of changes with the prescription drug plan or Part D for 2025 with the Inflation Reduction Act. We'll touch on that a little bit. Here's the big one that we're going to cover and the one you're probably most interested in: Medicare Advantage versus Medicare Supplement or Medigap. We'll go over the pros and cons of each, but ultimately, you're going to probably choose one of these options, and it is kind of pretty much the biggest decision you'll make in this process. I'm going to say this a few times during the presentation, but everyone's situation is unique. There's no cookie cutter scenario here. So there is some nuance, and no matter what we do here, I encourage you to schedule an appointment so that we can dive into your situation. But everyone's situation is unique, and we'll help guide you through it no matter what it is. So what is Medicare? It's federal health insurance for people over the age of 65 for the most part, or some folks that have certain disabilities can get Medicare as well. And went into effect in 1965 signed into law by President Johnson. All right, so I want to keep this simple. I know that you're overwhelmed. I know you're worried about all the different letters. We're going to go over original Medicare, A and B. We're going to go over all that. But I want you to just keep this in the back of your mind that there are ultimately two options that you're going to go with. One of two options. You're either going to go Medicare Advantage or Medicare Supplement. That's like 99% of people go with one of these. So you don't have to worry about how Part A and Part B and all the letters work as much as just knowing, hey, I've got to choose one of these, and then those will affect the way that Medicare works. This will make more sense here in a few minutes, hopefully, if I explain it well enough. All right, so we are going to touch on original Medicare, but again, take it with a grain of salt, okay? Because these numbers will change once you choose one of those directions, either Medicare Advantage or Medicare Supplement. Part A is your hospital coverage. If all these years you've been working and they take out that little Medicare tax, and you're like, what is this for? Well, this is what you were paying for. Part A of Medicare, your hospital coverage. So there is no monthly premium for Part A. You've earned it. So you can get it for free. How does Part A work? Again, this could change or will change depending on which direction you go, Medicare Advantage or Medicare Supplement. If you did not have a Medicare Advantage or a Medicare Supplement plan and you just had Part A and you went to the hospital, then you'd have a $1,676 deductible. And that'd cover you for the first 60 days. And then there's a per day copay after that. Don't get hung up on those numbers. Just know that Part A is your hospital coverage. You don't pay a monthly premium. And then there could be some out of pocket costs depending on which direction you go. We'll come back here in a second. Part B is your doctor's office coverage or your medical portion of Medicare. Part B is not free for most people. The standard monthly premium is $185 a month. And how Part B works is you pay your monthly premium of $185, and then you have a $257 deductible, which means you have to pay 100% of the cost up until you pay $257. Then Medicare Part B kicks in, and Medicare will pay 80%, leaving you responsible for 20%. That is the basics of Part B right there. There is a monthly premium for most people. Some people could pay less or nothing, or some people could pay more. But this is the core Part B. And again, this is going to change depending on which direction we go, Medicare Advantage or Medicare Supplement. So don't get too caught up on this yet. I'll reference back to it here in a moment. This is an IRMA chart, income related monthly adjustment amount. And if I just said, hey, if you make over a certain amount of money, then you could pay more for your Part B. And these numbers, we're not going to dive into this chart too much, but if you are an individual filing individual tax returns and you make over $106,000, then you could pay more for Part B. If you're filing joint tax returns making 212,000, you could pay more. Again, I'm not going to dive too deep, but they do look 2 years back at so right now they're looking at the 2023 tax returns, and it's based off your modified adjusted gross income. If you feel like you're in one of these scenarios, definitely schedule an appointment because we've had great success with getting these appealed. If you retired, because hey, you're like, hey, I'm not making what I was making 2 years ago. So we can definitely help with this. All right, Part A and Part B, original Medicare. Who should enroll? So in a nutshell, if you have access to employer coverage, you can keep it. You do not have to go to Medicare if you have access to creditable employer coverage. Now, Medicare deems creditable coverage through an employer being the employer has to have more than 20 employees. That's how they deem it creditable. So if you have access to employer coverage, you can stay on it. You do not have to go to Medicare. You may have a spouse that is on your coverage and say you're turning 65, but your spouse is 63. Well, and she's on your employer coverage. You may want to keep going on the employer coverage until the spouse turns 65. So if you have access to other coverage, you can stay on it if it's creditable and you will avoid penalties. But if you do not have access to other coverage, then you have to enroll in Medicare or they will penalize you. You've got to take that Part B. Part A is free, but you got to take the Part B. We'll make a little bit more sense of this here as we go as well. When should you enroll? So typically you want to enroll 3 months prior to your birthday month. So if you're turning 65 in June, let's say June 15th of this year, well, let's see, May, April, March. So you'll want to start applying March 1st, and then your Medicare would kick in June 1st. So typically you're starting about 3 months prior to your birthday month. How should you enroll? So if you're drawing Social Security, you will automatically be enrolled into Medicare Part A and B. They don't even ask you, they just send it out and say, here you go. Well, you may not want to go to Medicare and you can decline the Part B. But let's say that you are not drawing Social Security. Well, they do not send you a letter or give you a call and say, hey, it's time. It's Medicare time. Let's go. Nobody reaches out to you, which is crazy to me. It's job security for us. So I hope they never call you guys and tell you, hey, it's time. But yeah, no one's reaching out. So that's where these penalties can come in if you don't make some decisions right here right before turning 65. So, how should you enroll if you are not drawing Social Security and if you're not automatically enrolled? You'll do it through the Social Security Administration. We can help you with that. You can go down to the Social Security office. I wouldn't encourage that. That's usually a mess. You can do it online, but you just want to make sure you're doing it correctly, and we can help guide you through that process as well. If you are, I'll touch on this really quick. If you are working and you say, okay, I'm going to keep my employer coverage because I have a spouse on it, or I just like my employer coverage. I don't want to go to Medicare. You still should apply for Part A in almost all situations. So almost everyone should take Part A if it's free, if you've worked 10 years of your life, because it can only help you. It can't hurt you. And it doesn't cost anything. Now, I said almost all scenarios. Well, if you have employer coverage and you're contributing to a health savings account or an HSA, then you should probably not contribute. You should not enroll into Part A. Excuse me. There's some tax implications there. And so you want to be careful. If you're contributing to a HSA and you have this high deductible plan at your work, then you should probably avoid applying for Part A. And again, set up this consultation. We are happy to go through this, and you're getting so many phone calls. I know it. And you're a hot commodity right now. And because you're valuable to insurance companies or insurance agencies, they want to sell you a plan. And what I'm getting at is we love shooting people straight. And when you call us and we know that it's not right for you to move to Medicare, we'll tell you that and say, no, look, you need to stick with that plan. Give us a call in 3 or 4 years or whenever the time's right. You get caught up on these call center phone calls and they're trying to make a sale. So they're going to push you to enroll into Medicare right now so they can sign you up for something and make a dollar. So just be cautious of that. All right. What is not covered by Medicare? Dental, vision, and hearing benefits are not included. Gym memberships, prescription drug coverage or Part D coverage is not included, and long-term care insurance. So we're going to go over a few ways that you can include those into your Medicare, whether it be through Medicare Advantage or through a standalone plan that you may attach to a Medicare supplement. Getting the cart before the horse a little bit here, but all right. So again, at the beginning of this webinar, I said there are two main options, and this is really what I want you to focus on. There's Medicare Supplement, which we're going to call option one. They're also known as Medigap plans. This is option one. This is a true secondary insurance. So if Medicare is your primary, this Medicare Supplement would come in and kind of fill the gaps of what Medicare doesn't cover. Okay, these are the two most popular Medicare supplements right now. There are a number of other plans that we honestly just don't see or deal with for a lot of reasons. Plan G or Plan N is probably what you're going to go with if you're going with the Medicare supplement. So if you want a Plan G supplement, you will have a premium to pay each month on top of your Part B premium. Remember I said, gosh, where's my layer? Okay. So you have to have Part A and Part B to enroll in a Medicare Advantage plan or a Medicare supplement. You can't just get Part A and then get the supplement. You have to have Part A and Part B. So you're paying that monthly premium for Part B, and now you're going to pay your monthly premium for your Medicare supplement. How does a Medicare supplement work? And here's some rates, just average rates for a female or a male is different in Georgia and South Carolina. So don't hold me to these, but this is a nice average there. So a Plan G supplement,
Hey Chip, sorry to interrupt, but your screen is no longer sharing again.
it's not.
No, sir.
It's saying stop share. Okay. Well, I appreciate you telling me that because it's saying I've got it here. What about now?
There we go. I see you now.
Thank you. Thank you. Thank you. Yeah, flag me down. I was in the zone over here talking to Zero Slideshow. I couldn't go back. Okay. Tell me if it goes away again because the way this thing's like hiding over it. Is it still there?
Yeah, still there.
Good to go. All right. Plan G supplement. So if you're paying this monthly premium for your supplement, then Plan G will pick up everything that Medicare Part A doesn't cover, which means there is no hospital bill at all if you have a Plan G supplement. It will pay the entire deductible that I referenced, the $1,676 deductible. So you'll have no hospital bills if you have your Part A and Part B, and then you have that Plan G supplement. So that's great. These things are really nice if you can fit in your budget. Then when you go to the doctor, remember that Part B deductible, that 257 that I said you had to pay first out of your pocket? You got to pay the first $257 at your doctor's office, and then Medicare Part B picks up 80% of the cost. Well, the Plan G supplement picks up that remaining 20%. So you'll have no doctor bills once you meet your Part B deductible. There are some foreign travel benefits, emergency care, and it's like $50,000 lifetime benefit and an 80/20 split. So they'll cover $50,000 in your lifetime internationally and with you paying 20% of the cost. Okay, that's Plan G, which is extremely popular. Plan N is becoming a little bit more popular as well. As you can see, the price point's a little lower. The premium's a little lower, which is nice. It's the same as G, as in there are no hospital bills at all, which is great. The difference is at the doctor's office. So you will have a $20 copay each time you go to a doctor, whether it's primary or specialist, and that does not count towards the $257 deductible, which N also has. So you'll have to pay the $257 deductible and a $20 copay every time you go to the doctor, even if you've met the deductible. If you go to the emergency room, you have a $50 copay. There's this sneaky little thing here, excess charges, which I'll bring it up briefly. I think less than 4% of doctors or hospitals across the country charge this. Are And it's essentially when a doctor charges more than the Medicare allowable amount, then you could get hit with some of these charges. It's not significant. I think it could be up to 15%. And it's just something to be aware of. I don't want to not say it. We don't see it. I don't think I've ever seen an excess charge. I don't know, Brett, if you have, but I haven't seen one. But I don't know what the future holds. So I don't want to say don't worry about it. And then the healthcare system says, hey, let's just excess charge everybody. I don't know. So this is option one Medicare supplement. What are some advantages to a Medicare supplement? Well, there are no doctor networks at all. So Medicare is a federal plan, right? And This supplement is a secondary plan that just comes in and it follows Medicare. So as long as Medicare will cover the cost, as long as Medicare approves the service or the treatment, the supplement has to come in legally and pick up that remaining amount or however your plan is built. So you could travel across the country as long as someone takes Medicare, they have to take the supplement. Easy billing. We don't see a lot of claims issues. If you've ever gone to have a surgery with your current insurance, they may have said, "Hey, well, did you try taking this medication first? Did you try physical therapy first before we go have this big surgery that's going to cost a lot of money?" If you've ever seen that in the past, we don't see a lot of that with the Medicare supplement because, and doctors like to take Medicare supplements because it's a lot easier for them to get things approved through Medicare, and therefore the supplement can come in and pick up, fill the gap. Something I just thought of, I'm seeing all these things with Elon Musk and the Doge team going in and finding all these costs. I wonder if that's going to be affected at all. How they're approving, how doctors are saying, "Hey, things are getting easily approved with Medicare." I don't know, just a thought. And I'm talking to myself here because Brett, you got any thoughts on that? Do you think that's good? Okay, good. Thumbs up. Great. Let's keep going. We'll see how it shakes out, but it's just something I thought of. Travel, again, you can travel with a supplement because it's a federal plan. There's no underwriting when you are new to Medicare. So you can get a Medicare supplement without health questions. You're guaranteed to get it when you're either turning 65 or if you delayed your Part B because you kept your employer coverage. Whenever you begin Medicare, you could be 68, 69, whenever it is. Whenever you start Medicare Part B, then you can get a supplement without health questions. So that's very important, especially if you have health concerns. You know, it would be hard for you to get it if you wait 6 months past you being eligible for Medicare. Then they would ask you health questions and they could deny you. So one advantage is there's no underwriting when you turn 65 or when you start Medicare. Some disadvantages. Remember that premium I was telling you have each month? Well, that does go up over time. This 115 or 125, we've seen them stay the same, not so much over the past few years. You're looking at a 7-8% increase. I would just bank on that each year. You can expect that premium to go up. There is prescription drug coverage is not included in a Medicare supplement. So you have to buy a standalone prescription drug plan, which is known as Part D, D for drug. These plans range anywhere from 50 cents all the way up to 150, $200, kind of depends. I don't want to scare you with that, but it is an additional cost and it's all based off of your medications and it's something that we shop each year for you. Dental, vision, and hearing benefits are not included in with a Medicare supplement. So that's something you have to buy separately. All right, Medicare Advantage or Part C. So this is what you see all the commercials about. This is what you're getting all the advertisements and everyone's saying, "Hey, here's a food card. Here's a gym membership. Here's dental and vision, and we'll give you glasses and you can go buy golf clubs with this card." And some of that is true. There are some goodies here with the Medicare Advantage plan, but you kind of got to play the game a little bit. There are some restrictions with the Medicare Advantage plan, but it's still a fine option. I could make a case for Medicare supplement or a Medicare Advantage plan. I've got some family members on one, some on the other. Kind of depends on your health and your finances. So, a Medicare Advantage plan essentially replaces your Medicare Part A and B. It basically becomes your Medicare. So Medicare says, "Hey, we think that John, your health care is roughly $1,500 a month." That's kind of what they're thinking. Medicare is kind of putting aside. And so instead of them just putting it in a bucket each month, getting ready for you to spend it, they said, "Hey, we'll give it to these Medicare Advantage companies, United Healthcare, Humana, Aetna, Blue Cross Blue Shield, Anthem. We'll give them the money, but they have to assume your risk and they have to give at least as good a coverage as what original Medicare gave. And you'll see it is better, in my opinion. I think you'll agree here once I go through it. So let me dive in. You have to have Part A and B to get this Medicare Advantage plan. Don't forget. There are a ton of $0 premium options. So you have to pay Part A is probably going to be free. Your Part B is $185, but you can get this Medicare Advantage plan, and there are a ton of options that are $0 a month. So one of the biggest benefits is you have predictable copayments. I put an example Medicare Advantage plan over here. This $5 primary care physician, $30 at the specialist. If you go back to original Part B, if you didn't have this Medicare Advantage plan, well, you'd have that $257 deductible, and then you'd pay 20% of the cost. Well, you go to the doctor, you don't know how much they're going to charge you or what that could be. So that could be a little bit scary. But going with Medicare Advantage, you will have that predictable copayment. And again, this is an example plan. So this one, $5 at the primary care doctor, 30 at a specialist, hospital coverage. A lot of these Medicare Advantage plans are built to a per day copay in the hospital. And in this example, we made a $300 a day for days 1 through 7. So if you were going to the hospital for 1 day, pay $300, 2 days, $600, and so on. And they would cap at day 7. Again, not all plans are built like this. Some are 4 days with a higher copay. We just kind of created one here to give you an example. But if you look at it, say you had original Part A. I'm trying to click back without doing whatever I did earlier where I stopped sharing. So if you didn't have a Medicare Advantage plan or a Medicare supplement, remember, you'd have that $1,600 deductible that you'd have to pay right away, right? And if you go into the hospital for a paper cut, you're going to get hit. You're going to pay that much. But if you go in with a Medicare Advantage plan, then you'll know, hey, I've got this copay for that 1 day. Same with an MRI or a CT scan. It's kind of like a la carte. It's like a menu with a Medicare Advantage plan. You're like, I'll take an MRI, $275. That sounds tasty. Well, that's a lot better than paying 20% using your Part B, which could be, way more than $275, or an outpatient surgery. These Medicare Advantage plans will have a outpatient surgery copay. Let's say it's around $375. That's a lot better than going having a total knee operation and you're paying 20% using original Part B. One cool part of the Medicare Advantage plans, they have max out of pockets. Typically, we're seeing them more around the probably 7,500 to 8,000 range right now. The highest they go up to, I think, is like 9,500 right now, Brett. Is that right? Max out of
Yeah,
pocket?
that'd be average in network max out of pocket. Yeah.
Okay. So, and that's nice because if you were to need chemotherapy with original Part B, well, you'd pay 20% of the cost. And 20% of a lot is a lot. You can see these bills start to rack up. But if you have a Medicare Advantage plan, you've got this safety net to where once you hit your max out of pocket, let's say it's 6,500, you're not going to pay anything for the rest of the year after that. So that's a huge savings there. Predictable copayments is one good thing about the plans. Many of them have prescription drug coverage included, so you don't have to go buy that separate plan. A lot of them have dental, vision, and hearing benefits included, over-the-counter benefits, gym memberships, and some of those goodies that we were talking about. So what are some disadvantages to the Medicare Advantage plan? There are doctor networks that you have to worry about. These plans are very, I'd say, regional, and the doctor networks are getting much stronger as these Advantage plans become more and more popular. So odds are we're going to be able to find a plan that has all of your doctors in it. I'd be surprised and if we couldn't, unless they just didn't take Medicare. So, but it's something to be aware of. Claims and authorizations. Remember how I said original Medicare is likely to approve things much easier, and then a Medicare supplement comes in and pays, the rest of it. So that's kind of an easier path. Well, now that a Medicare Advantage plan replaces your Medicare, becomes your Medicare, now it's an insurance company saying, hold on 1 second. Did you try Did you try this physical therapy? Did you try this medication before we go spend tens of thousands of dollars on a surgery? So, just something to be aware of. We don't see it a ton. Referrals, you could need them if you have an HMO. This is becoming less of an issue. Service areas, again, they're very regional. Depending on where you are, is the type of plan, depending on whether it's a PPO or an HMO. And I'm not going to dive too deep into that, but just some of the disadvantages there on a Medicare Advantage plan. All right, so I always give this example. When I go to buy a car, which I do very rarely, but when I do, and it's probably why I have the same, car for so long, it's because I don't want to go there and I'm haggling and we're negotiating all the things. I'm like, what's the price? It's like tax, tag, title, what is the price? And so what I want to give you here is when you're sitting down at the dinner table tonight and you're trying to write out your budget and you're like, okay, so what are we going to pay? Like, what is that all in amount? I'm going to try to give this to you here. And this was easier before. Now that Part D, the prescription drug coverage, how this can fluctuate, it's harder for me to give you that, what I'm trying to do here. But I'm still going to give you something close enough where I feel like you could make some decisions off of it. So remember, you've got to have Part A and Part B to do either option, either Medicare Supplement or Medicare Advantage. Remember, Part A is $0 a month because you worked 10 years of your life and you earned Part A, hospital coverage, whether you go Medicare Advantage or Medicare Supplement. Medicare Supplement, $185 for Part B of Medicare. Most people will pay that amount. You could pay zero if you're making under a certain amount of money. I think that is tip around $1,400 a month income wise. I think if you're making less than that, then you could get a $0. You could get your Part B paid for by Medicaid. And okay, so let's stick with Medicare Supplement. You're paying zero for Part A, 185 for Part B, and now you're paying your monthly premium for your Medicare Supplement. Let's say it's about 120 bucks a month. Then you got a prescription drug plan. I put $12 down there. They vary, but let's just say it's about 20 bucks a month. And then remember, these do not include dental, vision, and hearing plans. So you want to add that on. You can get one for around 45. So really, if you're looking at it, I'd say about $375 is kind of the price that if you say, okay, between my Medicare and my supplement, my prescription drug plan, and if I wanted to get a dental, vision, and hearing plan, you're looking at around 375 bucks all in. But remember, you won't have any hospital bills because the supplement is going to pay everything that Part A doesn't pay. And you really won't have any doctor bills either, other than the $257 deductible. So, you're not worried about a lot of out-of-pocket costs. You're just worried about paying your monthly costs, monthly premiums. All right, on the flip side, Medicare Advantage, what's the out the door price here? Part A is free, $0. Part B is $185 a month, as we said. The Part C, or the Medicare Advantage plan itself, there are plenty $0 plans. So you don't pay anything a month for the plan, for the Medicare Advantage plan. Many of them have prescription drug coverage included, Part D. So you don't have to buy that separate plan. Many of them have the dental, vision, and hearing benefits included. So you don't have to buy that. So you're really looking at $185 all in for a Medicare Advantage plan, really just your Part B premium. Now, something we highly encourage folks to attach to a Medicare Advantage plan is a hospital indemnity plan. They are very affordable. You can get one for around 35 bucks a month, and I'll show you how it works. And this is kind of a hybrid between the two if you're looking for some middle ground here. So for about 35, 40 bucks a month, you can fill the gap of this hospital cost on Medicare Advantage. And basically, this hospital indemnity plan, we would build it to match your Medicare Advantage plan. So in this scenario, we would get you a policy that would reimburse you $300 a day every day that you were in the hospital. It's just like Aflac or any other type of indemnity coverage that you've had. They will write you a check. So that you pay your invoice, they write you a check, and then it's a wash if we build it correctly. So it's definitely something I would consider. And again, there are some health questions that you will avoid health questions or underwriting if you get it when you turn 65. So you're looking at an all-in cost of around, 220 bucks for Medicare Advantage. That's with the hospital indemnity plan. So 375 and about 220 over here. I hope that helps you when y'all are hashing this out over a chicken pot pie tonight. I don't know why I said that. I'm feeling chicken pot pie right now. No, it's not a very popular lunch dish. Maybe I'm just hungry. Haven't eaten. All right, so if you're a veteran, thank you for your service. We really appreciate you. And there are a lot of different directions we can go. If you are a veteran, there are some well-deserved options. And it comes down to there are Medicare Advantage plans that can coordinate with your TRICARE or your VA coverage that may give you additional benefits that aren't offered kind of through the government platform, like dental, vision, hearing benefits. There's some over-the-counter benefits, but the biggest thing that we see for veterans that are in one of these paths here is they will actually reimburse you some of your Part B premium. They call them these give back plans where they'll give you $100 back on your Part B or $150 back. So there are a lot of options. And if you have any specific questions, we'll try to answer those in a second. Inflation Reduction Act, I'm not going to dive too deep into this. In a nutshell, the big takeaways here. The donut hole. I'm not sure if any of you guys have heard of the donut hole, if you have a spouse that has gone into the donut hole before, but you don't need to worry about it because it's eliminated. Okay. The donut hole is gone. In the past, you would have to pay 25% of the cost once you hit some magical number. Don't worry about it. Don't even bore yourself with, even though donuts do sound nice right now. Also, what's for lunch, Brett? One of the
You're making
big
me hungry.
takeaways, one of the big takeaways of the Inflation Reduction Act is it capped drug costs at $2,000 for the year. This has been great for some folks. Now, we really haven't seen the ripple effect yet of what this is going to do to Medicare. And we did see some benefit cuts on the Medicare Advantage side because of the carriers having to pay so much more to cover the cost of drugs to kind of follow the rules there and cap it at 2000. But it's great. If you're taking some really expensive drugs, $2,000 is the most that you will pay in a year as long as your drug is covered on the formulary. Deductible phase, initial phase, catastrophic phase, a lot of plans. Kind of the standard prescription drug plan this year is a $590 deductible. Some plans have a $0 deductible. Some have it somewhere in between 0 and 590. Every person's different. Every plan's different. It depends on your drugs. If you're taking notes, don't worry about this. And then kind of the core is the member has to pay 25% of the cost. This can change depending on which plan because the carrier might help or the manufacturer. There's a lot of nuances here, and you'll have predictable co-payments. So I wouldn't worry too much about this slide. Just know that the most you can pay is $2,000 in a year, and then you hit this catastrophic phase, which your drugs will be free for the rest of the year. They did introduce this new Medicare payment plan, which is kind of cool for anyone who did have expensive drugs. A lot of times that deductible will hit you in the beginning of the year, and it's like, whoa, I've got to pay a whole bunch right here in January and February. Well, they've given you the option now that you can spread that out over 12 months, and you would actually pay the insurance carrier instead of paying the pharmacy. So, already said, donut hole's gone, 2000 max. And it did have some of the cons. It did affect some of these plans, as I mentioned. We saw a lot of Medicare Advantage plans leaving the market because they were taking on this burden of the prescription drug costs. The increased premiums on prescription drug coverages, as well, as I mentioned earlier, when it's a little bit harder to calculate that out the door price because prescription drug costs have gone up, the premiums at least. And okay, so what are the next steps? What do you do from here, right? You took all this information in. Hopefully, I didn't make you more confused than you already were. And I always joke, I asked one of my team members, I was like, I want something extremely simple that can just walk everyone right through the steps. And he built this treasure map of a process here. So I'm gonna try to figure it out with you. Schedule an appointment. We've got great guys that can walk through your unique situation. You can scan the QR code, schedule an appointment. You don't pay anything, commitment free. We will not pressure you at all. And then we'll help you figure out, hey, should you go to Medicare or should you stay on the coverage you're on? We'll shoot you straight. We'll help you apply for Medicare, whether it's just A or A and B. And then we'll help you choose one of those two options I was talking about. And I've got three on here. This is one you just rarely see anybody just go with straight A and B and then a prescription drug plan. So the two most popular are going with this Medicare supplement, as we talked about, with a prescription drug plan or a Medicare Advantage plan. So we'll help you choose one of those options. We've got an awesome support team, customer service team. When you call us, you're going to be able to get us. And if we don't answer, we'll get back to you really quickly. Every one of our clients has a dedicated customer support text line, so you can text us anytime. If you're thinking of something at 2 a.m. and you're like, oh, I just really was thinking about that. We might not answer at 2 a.m., but we will as soon as we get into the office. So a lot of these independent agents that you see out in the streets, they're a one man band, and if they're on vacation, then you're kind of your customer support's on vacation too. But we have a really nice team that is willing to help. No questions too small. And this is a big one, your annual review. Each year, hopefully this year when we don't have a lot of changes and you can just keep your plan going forward, but your prescriptions will change and your doctors change, and there's always changes, especially within this Medicare industry. So we're here to do a review, and it may be that this year we say, hey, Humana looks great, and you were on Humana. Well, it doesn't mean we're tied to Humana. It might be that United Healthcare is a better fit for you for next year. Whereas if you say you take this information from me and you say, you know what, I'm just going to do this on my own, and you call Humana and enroll with Humana, that's fine. But then whenever open enrollment comes around, you're going to say, okay, let me figure out what to do. And you call Humana and say, hey, are y'all still the best? And they say, of course, yeah, we're the best. Stay with us. So we're unbiased. We really want you on the best option. And then enjoy retirement. Don't stress about this stuff. Let us do it for you. There's no reason for you to worry about this. Let us take it off your plate. We're happy to do it. And that's it. Hopefully you have some questions, or Brett, I don't know if anybody's put any questions in the chat, or has it been pretty
We
quiet?
just got one. So
Okay.
Linda asked, can you change Medigap plans without questions or underwriting? And when you're new to Medicare, you're able to get Medicare Advantage or supplemental policies, no health questions asked. They cannot choose to deny you. They have to assume your liability. Now, that's important with supplemental, where later down the road, when you're no longer new to Medicare, whether you're trying to shop a new rate within supplemental insurance or just obtain a whole new carrier, what have you within supplemental, you will have to go through health questions, which they call underwriting. And so essentially you're presenting yourself to the carrier and saying, hey, you can pull my medical history. Here's my prescriptions. Will you assume my liability? So yes, they do ask you health questions and put you through underwriting when you're no longer new to Medicare. If you're reasonably healthy, it's typically not an issue. But who knows what the future holds, right? We could have a heart attack, stroke, something major happen in the future, and your chances of obtaining new supplemental coverage could be a little more limited. But once you're in, you're in. When you're new to Medicare, you could come to us with terminal cancer, God forbid, and you would be able to obtain that supplement, no health questions asked. So hopefully that answers that question. Oh, at any time. Yeah, let me clarify that. So supplemental, there is no open enrollments for this. So when you're new to Medicare, no health questions asked. One of the perks of supplemental is you can shop that at any time during the year. So, we'll monitor the rates. Obviously, you're going to be monitoring the rates. If we see the rate climb maybe higher than the competition and we want to shop rates, there is no open enrollment, because at that point, you can do it anytime during the year, because they do have to assume your liability there.
I see you have a new Bluffton office. What is the contact for that? Hey, Anand, so you can do a couple of different things. You can go to our website, and schedule an appointment, just skip the, hey, call in and then us set it up for you. And you can do that on, it'll put the link for you to go to that. Or the phone number is 843-781-6464. You guessed it. Was that what? It's easy to go from an Advantage plan back to original Medicare. It is during certain enrollment periods, whether it's the open enrollment period, you can do it, which is October 15th to December 7th, or during the OEP, which is, I'm sorry. So I call it open enrollment, which is October 15th to December 7th. It's the annual enrollment or annual election period. But there's basically 6 months out the year that you can go back to original Medicare from a Medicare Advantage plan. And then, if you wanted to go to okay, so I don't know if this is what you're asking, but it sparked something for me. If you're trying to decide which one to go with and you're on the fence, Medicare Advantage or Medicare Supplement, I always encourage people, if you can fit it in your budget, go Medicare Supplement first because it's much easier to downgrade, if you will, to a Medicare Advantage plan down the road than it is to upgrade to a supplement because you have to answer health questions. Also, Harvard did this study, or it was Yale, or one of those really smart universities. I'm pretty sure it was Yale. It was Stanford. Actually, look at me. I'm all over the map. It was Stanford. I'm pretty sure. We'll Google that. I'm pretty sure Stanford did the study that 65-year-olds were diagnosed with all kinds of things. It's not because when you turn 65, all of a sudden, like, you know, it just hits you. It's because healthcare is so expensive all the way up until you get onto Medicare. Typically, you get Medicare and you're like, oh, okay, I can go to the doctor and it's not going to, kill my wallet. Well, they start to find things because you're actually going to the doctor. It's not that you probably had them for a few years or you just weren't getting checked out. All that to say, I think it's smarter or maybe beneficial to get the supplement, go kick the tires, go to all the doctors, let the supplement pay for it. And then heck, heaven forbid they find something. Well, at least you've got the coverage in place. And so hopefully that helps. And if everything's fine, maybe you can downgrade to that Medicare Advantage. I hate saying the word downgrade because they're both fine options. It's just kind of one costs money and one doesn't, and there's some limitations and one covers, I don't know. One thing that I thought of before somebody asked another question or Brett wants to expand on that, we are in the OEP right now. Which runs from January 1st to March 31st. And you can make a one-time change if you have a Medicare Advantage plan. You can go back to original Medicare with a prescription drug plan. So if you have a spouse or a friend or family member or whatever, I know this is exactly what you want to talk about when you're hanging out with your friends is Medicare. But if you do come across someone, we can help them. They can make a change right now, most likely. And if they miss their annual enrollment period, well, because of the hurricane that came through, Hurricane Helene, they've actually extended that annual enrollment period window to February 28th. So if you're in Georgia and South Carolina and you missed AEP or annual enrollment, then there are options. Tell your friends. We'd love to help.